This video is on ischemic stroke. Ischemic stroke is infarction of cerebral arteries resulting in poor perfusion of the brain. About 80 to 85% of strokes are ischemic strokes, the other main type being hemorrhagic strokes, which we will not cover in this video. So let's look at the pathophysiology of ischemic strokes and bearing the definition in mind. So if there is poor blood supply to the cerebral arteries, it can be due to a problem of the cerebral arteries themselves, of the main neck arteries, or from the heart. So that's the basis of the pathophysiology. Hyaline arteriosclerosis of small penetrating arteries in the brain is often associated with hypertension. And it's the small arteries that are affected because they have a smaller diameter to start off with, so some arteriosclerosis will have a bigger impact than in larger arteries. But large arteries can also be affected. For example, if there's a rupture of atherosclerotic plaque with embolization, this can result in a stroke. For example, atherosclerosis of the carotid arteries. If you want to learn more about how an atherosclerotic plaque forms and why it ruptures, please see our myocardial infarction video for more detail. You can also get a clot from the heart, and this is a mural thrombus with embolization. The risk factors being a past history of myocardial infarction, where you may have necrotic myocardium that does not contract properly, or persistent atrial fibrillation, where the atrium is not contracting in sync, and these form clots due to Virchow's triad. The risk factors for ischemic stroke are the same for cardiovascular disease, which are the same for peripheral vascular disease. And this is because atherosclerosis of forming clots is the same for all arteries and does not differentiate between a brain artery and a heart artery. So the risk factors are hypertension, smoking, type 2 diabetes, and heart disease. Clinical presentation is a sudden onset focal weakness. The specific type of weakness will depend on the area affected. If you want to learn more about the function of the different parts of the brain, please see our neuroanatomy sheet for further detail. So, going on to investigations, the FAST acronym is a good screening tool, which stands for facial asymmetry, arm weakness, speech issues, and that means it's time to call for help. And those are the most common focal weakness or clinical presentation, but are by no means exhaustive. The diagnostic investigation is a CT or an MRI, which is shown here. And this is important to do as soon as possible to exclude hemorrhage and identify the infarct, because as we will learn, treatment is time sensitive. Later, in a less emergent situation, you can locate the clot by doing carotid Dopplers, Holter monitoring for atrial fibrillation, and echocardiograms to assess the contractility of the heart. Management, so thrombolysis, can be done within 4.5 hours, such as alteplase, to lyse the thrombus to break up the clot. Thrombectomy, if it's below 6 hours, some may say 16 hours, it depends on your area, but less than 6 hours, and an image is shown here, where you put in a wire into the brain through the arteries to reach the clot, and then you literally retrieve it. Aspirin is an antiplatelet and is less time sensitive, and of course you want to address the underlying cause, for example anticoagulants for atrial fibrillation. And these time frames for thrombolysis and thrombectomy are important because you want to reduce complications, the main one being a hemorrhagic transformation of the ischemic stroke. Finally, before you discharge the patient, you want to assess for re-enablement. So are they going to be safe to go home? This includes swallowing because you don't want them to aspirate, as well as mobility. Thank you for watching. If you learned something, please tell a friend who may also find it useful.